Even when their office is open for just 10 hours, some doctors are able to get credit for more than 24 hours of work in a single day. It's possible because of the little-known way doctors' pay rates are set, with the guidance of a closed-door committee organized by the doctors' chief lobbying group, the American Medical Association. It's complicated, but basically here's how it works. 31 doctors picked by the AMA recommend values for every procedure in medicine, more than 6,000 codes in all. Those relative value units, or RVUs, are used to divvy up Medicare's $100 billion annual budget and, by extension, set the prices for health care in America. Is the AMA the right group to be setting these points?
Well, it's not their fault, but I think absolutely not. It's crazy to have the AMA. It'd be like asking the American Hospital Association to set hospital rates, or the oil companies to figure out gas prices. It's just, it's irrational. It's partially my fault.
As the head of Medicare in the early 2000s, Thomas Scully was the man who received the AMA's recommendations, and he says the group's lobbying power and the limits of his own staff made their suggestions impossible to ignore. Well, hold on a second. This is a group of physicians. Who knows better what it costs and how much resources it requires to perform medical procedures than doctors? Isn't the AMA the perfect group to do it?
Absolutely not. So who knows better? I would be fine if the same docs got in a room, but the AMA should not be picking who's there. That's the AMA's power base. If you're a specialty group, if you're the gastroenterologist or the neurologist or the orthopedic surgeons, if you want a seat at the table of this little UN of price setting, you better have you have to have X number of your members join the AMA and you get a seat at the table. I'm sure they're all trying to do the honorable thing, but everybody's pushing their own specialty. And if you're not there, you lose.
The lucky doctors perform procedures like code 45378, the diagnostic colonoscopy, which credits physicians for 75 minutes of work, even though the procedure is commonly scheduled for just 30 minutes. The AMA group responsible for those values is known as the RUC, and it's chaired by Dr. Barbara Levy. When you hear that there are potential conflicts based on the composition of the RUC, you say, no way, no how, we have this thing properly staffed and organized.
It is an expert panel. We need the expertise of people across specialties in order to be able to ask the right questions. And of course, we totally expect that every one of us as human beings is going to say what we do is the most important, most difficult thing, but that's all expected.
So you accept that if I'm a brain surgeon, I may overvalue brain surgery in the discussion, but you're saying the other 30 people in the room will counteract that one person's bias?
Yes, when you have 31 people around the table and they're dedicated to a fair and objective process, in the discussion, those things start to sort themselves out, and they do.
But even as medicine has modernized in the 2 decades of the RUC, modern efficiencies haven't always been reflected in their estimates. The amount of time required for most of these procedures has gone up rather than down. How do you explain that?
I have never looked at a spreadsheet of the times. I can't answer with respect to times increasing. I think that's probably not an accurate statement.
But a post-analysis found that over the last decade, the value of the average procedure has risen by 7%, with 7 times as many codes going up in value as going down.
Now in and out.
And the RUC values have allowed certain specialties to bend time and space. At Florida outpatient clinics where medical records were accessible for analysis, the Post found 78 doctors working more than 24 hours a day, at least 1 day a week. Using these estimates, we found quite a few doctors, many doctors, who are working more than 24 hours a day. How does that happen?
It doesn't, obviously.
But Levy says those tallies of hours worked aren't the point. The RUC's job isn't to set absolute values, just to measure the relative value of all those procedures as a way of divvying up the fixed pot of Medicare money.
Recognizing that this is a relative scale, as long as in relativity things are correct, the absolute numbers don't matter. We can say this one is more than this one and less than that one.
You have them in the right order.
We have them in the right order, we have them in the right magnitude, and we have them in the right spread.
But the RUC's work is hard to check up on because the meetings are invite only and everyone who attends must sign a confidentiality agreement. Why leave yourself open to this charge of it being a secret committee? Why not just open it up and publish the votes and the minutes and all
So
that?
the votes are being published, and the minutes are published. The minutes are public.
And they're public for free? Can I access them without paying a fee to see those records?
I believe that you can.
But in fact, you can't. Accessing the database costs $320, and even those records don't disclose how committee members voted, just what the RUC ultimately decided. Votes will be published starting this fall, but Levy says more transparency could hinder the RUC's work.
I don't want a lot of political pressure from either the specialty society or industry or other people on RUC members to sway votes. So one of the reasons for keeping a lot of folks from being present at the meeting without signing the confidentiality is to keep some of that lobbying pressure off RUC members. And there are a lot of folks, as you well know, who are impacted by what CMS decides an RVU may or may not be.
You guys have an immense amount of power.
Well, it's an effort for us to keep that lobbying away from the RUC members.
The RUC is an attractive lobbying target because the values they set don't just guide Medicare reimbursement rates. That's because Medicare's prices are the basis for what virtually everyone else pays.
So it's effectively de facto price fixing for the entire healthcare system, because commercial insurers and Medicaid both ratchet off it and pay, pretty much shadow pricing to Medicare. So the Medicare pricing pretty much drives pricing for the entire healthcare system.
If the government came in and said, we want to run this now, thanks for your help, AMA, would you be cool with that, or would you push back against having it taken away from the AMA?
Well, you can't take away someone's First Amendment rights. So
it's a First Amendment right that the AMA gets to set Medicare prices?
We're not setting Medicare prices.
Oh, but you are, really?
But we are not. Everyone has the same rights as the AMA to provide input and recommendations to CMS. The fact that others choose not to do that is not on the AMA.